Now, the arrangement is now more or less clear according to the information we have. There are 352 Hong Kong residents. There are permanent, that includes permanent Hong Kong residents holding Hong Kong SAR passports and other Hong Kong residents holding foreign passports. We will take care of all of them and we'll arrange for them to come back to Hong Kong as soon as possible. Yesterday, we've sent first team task force to Japan. Mr. Chung Kok Wai and Mr. Ao Chi Kwong, that is the Deputy Director of Immigration and Undersecretary for Security, are now in Japan to make advanced preparations. Today, we are going to send another team of 30 to Japan. In the whole team, there are 8 medical staff from the Hospital Authority and the Department of Health. They will provide health care support to Hong Kong residents with needs during the process. Now, we have already debriefed all the teams, and they must take care of their own health and take proper precautions as they carry out their duties. We will also provide them with sufficient personal protection equipment. Now, among the 300 odd residents, the Immigration Department has been in touch with 97% of those successfully. Of course, there are 30 confirmed cases. These are in hospital. There are 10 Hong Kong residents we have not been able to contact yet. So I would like to make an appeal here. If you are listening to me now, if you have friends or relatives on the Princess Diamond and they have not been in touch with a government department, please ask them to contact our Immigration Department colleagues as soon as possible. As the Secretary for Security said at the airport yesterday, we have arranged 2 charter flights, each with 438 seats. So that's enough to take back Hong Kong residents to come home. The 2 flights will be going to the Haneda Airport tomorrow in Tokyo. I think the difficulty is to arrange transportation from the cruise ship to the airport, because it's now really difficult to arrange coach buses. And here we would like to thank our own embassy in Tokyo for giving us full support. I would like to say here, though, that we would very much like our Hong Kong residents to come back as soon as possible, but can we really leave as scheduled? There is now an uncertainty. Now, can the Japanese authorities complete all the testing by the 19th of February? That's a key factor. And also it depends on whether the Japanese authorities could arrange for all Hong Kong residents to disembark in one go on that day. We appreciate there are practical difficulties because there are other passengers on the cruise ship as well. And if there is a need to change the schedules of the charter flights, and another uncertainty is whether the Haneda Airport could arrange for the landing or the flight movements of these 2 flights. And now we have made the arrangement. We've got the slots, but if there's going to be a change to the schedule, we do not know if we could then make the arrangement again. But we'll try our very best. And then our own embassy in Tokyo is giving us full support. I understand Ambassador Ho is personally taking charge of this, and then the Ministry of Foreign Affairs liaison office will also send someone to Japan to help with the liaison. Here, I would like to thank the airline and crew members who volunteer to work on these 2 flights. So here I would like to say a big thank you to the air crew for helping to bring our residents back now as soon as possible. Now, there's some concern expressed in the course of making all this arrangement. That is, these Hong Kong residents have been on the cruise ship for 14 days, and now when they come back, we are going to subject them to compulsory quarantine again for 14 days, and people question that. I must stress that this must be done, because every single day so far, there are new confirmed cases among passengers. So for Hong Kong residents evacuated to Hong Kong, there remains a certain risk. Now, we want to take care of the health of the passengers, their family members, and also we need to consider our effort to try to contain the outbreak. So that's why when they arrive at Hong Kong, compulsory quarantine order will be issued, and then they will be sent to quarantine centers. Now, I've said this repeatedly during this time. That is, our quarantine arrangement is scientifically based, and we in accordance with the experts' advice. So I must stress again, for Hong Kong residents coming back from Princess Diamond, they are to be put under 14-day quarantine, and that is the consensus of experts, and this is from the point of view of public health hazard management. Now, of course, we know certain residents have expressed concern about them going into quarantine centers, but I must stress again that for these people going into quarantine centers, they do not have any symptoms, they are not confirmed or suspected cases, so people could rest assured. And then we have strict management of these quarantine centers. Round the clock, there are law enforcement officers and healthcare workers there. And then for people going into and out of the quarantine camps, there is special transport for them, so they won't be walking around in the local community, and there is therefore very minimal impact on the community. That's why we hope that there will be understanding and accommodation among local residents. It's like the airline and the air crew who are also contributing to bring residents back. Now, for the evacuation of Hong Kong residents from the Princess Diamond, of course, we are dealing with that. At the same time, we also care very much about Hong Kong residents stranded in Hubei province. That's a large number. And I know for some Hong Kong residents are really anxious to come back to Hong Kong as soon as possible. We have never stopped our work. We've been working on it all along. But then we have to consider that there is still a serious outbreak in Hubei province, and many of the public transportation has come to a halt, and so therefore, if we formulate a plan, we have to consider the health, the medical support, the transportation, and also as for quarantine facilities, now we have new quarantine centers coming on stream. Well, we can take care of that. Anyway, we will, when we are able to make any plans, then we will report to you all as soon as possible. And the third thing I'd like to talk about is that on Friday I announced the measures under the fund to fight the epidemic. There are 11 measures. I said then that our funding application will be no less than $25 billion. But in the past 2 days, we have done more evaluation. We've also listened to various views. This Friday, the total amount we're going to apply for would be close to $28 billion. And this funding application is going to the Finance Committee of the Legislative Council this Friday. We will explain all the details in the document. We will try to issue the document as soon as possible. Here, I would like to thank the President of the Legislative Council and members for supporting us. Tomorrow, there will be a special meeting, so members could ask questions of the government officials on our effort to fight the epidemic. And on Friday, there will be a special Finance Committee meeting. Now, many will stand to benefit from the fund. There are over 20 measures actually under the fund, and they are all urgent measures, so I very much hope that Logistical members will endorse the funding as soon as possible. And then when the relevant Finance Committee paper is issued, you can see that we will explain why each of the measures is urgent, and there will be an implementation timetable too. I've actually looked at each of the implementation timetables. Definitely, we are trying to address these pressing issues and to address address public concern, and this will be timely relief for all concerned. So we hope very much, therefore, the funding proposal will be endorsed, and then we could disperse the funds to those in need as soon as possible. I must stress again that this how this fund to fight the epidemic is related to the budget. Now, the budget will be announced, of course, on the 26th of February. The Financial Secretary will be announcing various measures to support businesses, support employment, and so on. For this fund I've announced, it's really to give direct assistance to sectors, workers directly affected by the epidemic. And also, the fund will help to enhance our capacity to fight the outbreak. So this is a two-pronged approach. Now, if certain sectors believe that they are not getting any targeted assistance under this fund, please be patient and wait for the delivery of the budget. And then in recent days, I'm glad to see that everyone in the community is trying to contribute to the effort to fight the epidemic. There are big businesses making donations, and others, trying to take care of those in need. So this is important to help us stand together in fighting this epidemic. Thank you.